Last Monday, I told you about a story coming out of St. Louis Park High in Minnesota about a student that had contracted active TB. We're doing a follow-up segment tonight with the Minnesota Department of Health Infectious Disease Director Kris Ehresmann. Kris, thank you so much for joining us and great to see you. I want to start with a question that one of the parents asked in the Care 11 story, and they basically said this. They said, what we'd love to know is how did TB make its way to St. Louis Park High School?
Well, TB is still happening in the United States. We have a lot less TB now than we used to, but in Minnesota we have 150 to 200 cases of tuberculosis every year. So it does still happen both in Minnesota and in the United States. And how does it get here? Well, it can come lots of ways. I brought TB back to Minnesota myself after I had done an international study abroad in college. So there are lots of different ways, but oftentimes people who are coming, back into the United States from traveling abroad will bring TB with them.
And I think I want to get, so how did you contract it? I mean, did it have someone just happen to sneeze on you, or do you know?
Oh, well, I spent a semester in India as well as traveling to Nepal, and there's a great deal of tuberculosis in India, and I had also contracted typhoid when I was there, so I was somewhat immunocompromised. It was a very interesting experience for someone that was going to go into infectious disease later in her life. And I'm sure that set me up for transmission. But in general, in order to contract tuberculosis, you need to have prolonged exposure with individuals who have the disease.
Let's get to some dates here. What date specifically, because as you know better than I do, TB is a reportable disease in the state of Minnesota by law within 24 hours. So what date were you alerted at the Minnesota Department of Health that there was a suspected TB case in St. Louis Park High School?
Well, disease can be reported to the state health department or to local health departments. And so Hennepin County would have received that information. And so they were made aware of some test results on November 7th, but they had already been working with the situation because the individual had been removed from the school setting on November 4th.
And so from my understanding is it takes a while to get the test results back, whether they're positive or not. So was Hennepin County alerted then when the suspected case went to get tested?
Yes, they would have been working with the healthcare provider, and in fact, Hennepin County actually has a tuberculosis clinic in their county, and so they have an expert physician there who deals with TB, and so they would have been working with that individual on the situation, on the case.
So my question then is if they, and correct me if I'm wrong here with anything, but one of my understanding from talking to people in your department and the Hennepin County Health Department is it takes a while from when a person gets tested for them to come up positive or not. So knowing that a suspected case was in, it sounds like they just let that person then continue to go to school even after they were tested. Is that accurate, and is that the right thing to do?
No, they would, once the individual is suspected of having tuberculosis and there's evidence to that effect, then that individual is removed from the workplace, the school setting, that type of thing. So no, we would not have someone that we thought had concerns about having tuberculosis remain in a school, workplace, public setting.
So Hennepin County was notified, I think you said November 7th, and then they notified St. Louis Park High School when?
They started working with the high school later in November. The way that we do investigations of a TB case is that we would start with the closest contacts. So that would be household contacts of an individual, and then move to school and workplace contacts. So they would have started on the investigation, but just started with household contacts initially.
One of the things I really wanted to focus on tonight with you, Kris, was parental rights and a parental right to know. As we've talked about the story, and I'm sure you've heard it more than I have, and parents are upset that they weren't alerted sooner. So my question to you is, you're saying, hey, Kris, Hennepin County Department of Health knew in early November, but this letter sent out to parents via the St. Louis Park superintendent wasn't sent out until January 11th. Why was it take so long to send out this letter?
Well, there are a number of factors in terms of what we look at in terms of how notifications are done. But one of the things that was important in this case is to have information about who might have been exposed. So certainly the school could have sent something out, right away and said, oh, there was somebody with TB in our school, but that would not have provided any helpful information to parents. They wouldn't have known if their child had been exposed. They wouldn't have known what to do next, nor would their provider, because the providers are making decisions based on exposure. So by waiting, this allowed the public health department to work with the school to identify who had interacted with the individual who had tuberculosis. It also enabled them to set up clinics for testing so that when parents received information about their child's exposure status, then they had just what they needed to be able to have their child tested. And they don't have to be tested at the school, but it is free testing and it's on site, so it would be no challenge for the family.
But why not? I mean, you're talking about TB. As you know, this is the deadliest infectious disease across the world. I realize not in the U.S., but across the world it is. Why not err on the side of caution? Something similar happened in Omaha, Nebraska, also South Carolina. They notified the parents right away. With a disease like this, why not err on the side of caution and let people know, hey, right away, this is the situation, this is how we're handling it, here's our protocol?
Well, I think it's probably not accurate to say that it's the most deadly disease. TB is certainly a serious
the most infectious,
disease.
deadly disease, according to the World Health Organization.
Well, it certainly is an infectious disease that is common. A third of the world's population is infected, but in terms of the infectiousness or transmissibility of the disease, it's not particularly infectious. You have to have prolonged exposure to someone with TB in order to develop disease. So unlike something like measles, where it's an exceptionally infectious disease, you can be exposed to measles if you go into a doctor's exam room 45 minutes after someone with measles has been there. And so TB is not like that at all. So different diseases require different levels of sort of heightened notification, and I would definitely say that TB does not fall into that category. It's much different from measles.
But that gets to my point. If you're saying, hey, Kris, this isn't very infectious, what I'm going to insinuate here, I don't want to put words in your mouth, is because it's not so infectious, Kris, a lot of people at the school, I'm assuming you're going to say, are not at risk. So that's my point. Why not then err on the side of caution and say, hey, we just want you to know there's an active TB case in the school. We are being more transparent rather than waiting for 8 weeks to tell parents and nullify their rights as parents.
Well, that certainly is something that was discussed with the school and public health. But I think what you have to keep in mind is if parents would have been notified, they wouldn't have had any information in terms of their child's risk, and their healthcare providers wouldn't have had the information that they needed in order to take appropriate action, because it's a relatively small proportion of students who actually had any type of exposure. So the majority of students, there's no need for testing, there's nothing that needs to be done. And so to have notified parents without information about exposure or testing would have simply raised their concern, but there would have been no action that they could have taken at the time.
Right, but isn't that the Department of County Health's job to inform people like, hey, here's the reality of TB, here's the situation that we have, but we want to be transparent and let you know?
Sometimes, people choose to do that, and you identified several health departments that took that approach. In this case, the feeling was that providing parents with information that allowed them to know their child's risk as well as to take action was the best approach. And so at this point, parents received a message. It told them if their child was at risk. It told them that if so, there was going to be testing offered in the schools. They could return a consent form so their child could be tested, and it all was provided to them at one time.
So I don't know if you're a parent or not, Kris, but if you were, would you want to know sooner rather than later if there was an active TB case in your son or daughter's school?
I am a parent, and I would want to know what was my child's risk and what I should do about it. And until that point, and if it wouldn't make a difference in the outcome, then yeah, I wouldn't be concerned. So I'd want to know, had my child been exposed and what should I do about it? And until I could know that, I guess I wouldn't see the need to worry unduly for weeks and weeks.
Let me ask you this, what protocol or law did you guys follow that gives you a right to not say anything for 8 weeks to alert parents of active TB in a school?
We follow the Centers for Disease Control guidelines related to tuberculosis, and so that's the protocol that we use, and that basically is used around the country.
But again, Omaha didn't do that, South Carolina didn't do that, so what specific CDC guideline are you using that's telling you not to inform the public immediately?
There is no specific guideline on informing the public.
Wow.
That's not specific. The things that we look at, there are a number of factors that we look at when we take into account whether the public needs to be notified. We look at what the disease is. We consider the mode of transmission. So we would consider, diseases that are spread by food item, some respiratory diseases would be something that we'd consider. We also look at the transmissibility or infectiousness of a disease, and certain diseases like measles are highly infectious. And so we need to alert people right away. Another factor is whether or not anything can be done related to the illness by taking quick action. And so for some diseases, by letting people know, you know what, you've been exposed to this disease, if you're vaccinated or if you receive immune globulin, it could help to prevent disease from occurring. Then we have a very, very short window of time in order to take action and notify people. But for other diseases like tuberculosis, there is no benefit. The outcome does not change based on when someone is notified. Another factor is the incubation period. For some diseases, the time from exposure to the disease until the disease occurs is hours or days. In other situations, it can be weeks, and in those cases, you do have some leeway.
Kris, let me ask you, I don't mean to interrupt you, I got 2 more questions for you, but
Okay.
do you guys think you got this right? I mean, looking back, do you think, gosh, we should have alerted parents back in early November?
I do think I have it right, and I don't think there was any purpose to notifying parents.
All right, so what I've been told is that there's 1,400 students at St. Louis Park High, the way you go about following your protocol to figure out, hey, who's possibly been contracted or infected with this disease, there's now 166 people, and my understanding is that the way you go about this investigation is you're basically just taking the person that was infected, his or her word for where he was, what classes he or she, I should say. Is that true that you're basically just taking this person for their word, and that's how you're determining there's 166 people that could be infected?
Well, there's several factors that go into a contact investigation, and certainly interviewing the individual who has tuberculosis is part of that. But then another factor would be to look at the individual, like in a school setting, we'd look at the individual's class schedule and extracurricular activities and things like that. So there are checks and balances, so it's not completely dependent on what someone says, but certainly we do rely on what the individual says to help and guide us in the investigation.
One thing that I know people are looking for is more and more transparency from Minnesota Department of Health, Hennepin County. So if you can clear this up, that would be great, because many people are suggesting this. There's been no proof of it. Can you confirm or deny that the person that was contracted or initially had the active TB was a refugee or not?
There's been no information about that's put out, and no, that's not something that we provide, because that could help to identify the individual. So we have not indicated whether it was a student or a staff person, and we will not comment on anything else about the individual because we need to maintain confidentiality.
Kris, anything else you want to add that I haven't asked yet?
Well, I just want to reiterate that it's very important to us that we're looking at a lot of different factors as we're considering whether or not individuals need to be notified. And I think that you've really suggested that that I don't know, that many of us aren't parents or we don't care, and that's not the case at all. We think that the best information.
Excuse me, I gotta be, please, I never said, I'm not suggesting that. I'm just asking that the parents that I've talked to and heard from this situation, not even parents, but people in general, like, why are they not telling people? If this is not that infectious as you say it is, then why not just tell people what's going on? So please don't put words in my mouth. Is that fair?
Well, no, but you were suggesting that somehow there was an interest on our part to withhold information. That's not the case. Our goal is to provide the best information possible and to provide complete information when we do talk with parents. And so that is to be able to say, here's the situation we're dealing with, here's the exposure that your child did or did not have, and here's what we recommend you do. And in order for us to be able to do that in a thoughtful manner, information was provided now in January. This does not increase the risk to the students, and in fact, the testing that will be conducted, we needed to wait for at least 8 to 10 weeks before we could even start it. So I think that's the rationale that we use, and I can certainly let you know that we at the Department of Health have not been getting calls from parents, and this occurred in the Twin Cities, and we are not receiving calls. Our TB program is not receiving calls from parents. So I realize that you have had people express concern, but we have not heard that.
Kris Ehresmann, thank you very much for your time. We appreciate it. And I know the testing is the end of the month, so maybe if there's a follow-up story, we'd love to visit with you more at that time, okay?
All right, thank you.
Appreciate it. Kris Ehresmann, again, she's the Infectious Disease Director for the Minnesota Department of Health. Stay with us. Coming up in tonight's Final View, love trumps hate. Many have heard that, but are people actually walking the talk? We're going to talk about that at the end of the show. And then coming up next, your points of view. Stay with us. Much more coming up right here on Point of View.